6 causes of foul-smelling stool. Bad-smelling stool can be caused by diet, a medication, lactose intolerance, irritable bowel syndrome, inflammatory bowel disease, or an infection.
Monitor what you eat and treat the underlying conditions.
1.
Dietary changes. Symptoms: foul-smelling stool every so often.
Abdominal pain. Diarrhea.
Eating foods that don't agree with you, such as dairy if you're lactose intolerant, or foods that smell bad, asparagus, durian, can all lead to foul-smelling stools.
If your stool smells really bad a few times in a row, it's likely that it's because of a food that you ate. If you are lactose intolerant, avoid dairy foods or take a supplement with lactase enzymes before eating dairy foods.
If symptoms continue or you also have severe pain or fevers, see your doctor to rule out other conditions. 2.
Irritable bowel syndrome.
Symptoms: foul-smelling stool,
abdominal pain,
nausea,
bloating, changes in stool, diarrhea or constipation. Irritable bowel syndrome (IBS) is a common, chronic disorder of the gastrointestinal tract gut.
People who have IBS may experience diarrhea, constipation, or a combination of both.
The most common symptom of IBS is stomach pain. Some people with IBS say they experience a bad odor and changes in stool.
If you suspect you have IBS, see your doctor. Although there is no cure for IBS, there are many treatments available to help control your symptoms. Medications include antispasmodics for belly pain and cramps, gut-specific antibiotics for diarrhea, and other medications. IOTICS.
Symptoms: loose stools while you're taking antibiotics and for a few weeks after you stop.
Foul-smelling stool.
Antibiotics can change the balance of your gut microbiome, a mix of bacteria in your gut.
This can cause changes in the odor of your stool and its consistency. These side effects of antibiotics are usually temporary.
They either stop after you complete your antibiotics or within 2 to 4 weeks. It's not usually a cause of concern. If your symptoms continue and bother you, your doctor may suggest taking probiotics. Your doctor may also recommend treatments similar to those for IBS, such as medications that relieve diarrhea.
4. Infection.
Symptoms:
foul-smelling stools,
abdominal pain and cramping, diarrhea,
rectal pain,
increased urgency or need to defecate, fever, fatigue, nausea,
loss of appetite. Gastrointestinal (GI) infections have many causes, including bacteria, viruses, or parasites.
If you have an infection, you'll usually also have other symptoms, such as diarrhea or abdominal pain. See your doctor, who will do tests to identify what caused your intestinal infection.
If it's a bacterial bug, your doctor will likely prescribe antibiotics. If you have a parasite, they may give you an antiparasitic medication. If it's viral, there is nothing to cure the illness.
Treatment will focus on staying hydrated and resting. 5. Inflammatory bowel disease. Symptoms:
foul-smelling stools, fatigue,
fever,
bloody diarrhea, weight loss, mouth sores, joint pain. Inflammatory bowel disease (IBD) is an inflammation of the digestive tract. There are 2 types of IBD: Crohn's disease and ulcerative colitis. Symptoms may develop gradually or they can occur suddenly. IBD is caused by several factors, including genetics. If you have a parent or sibling with IBD, you have a higher risk of developing it as well. Lifestyle plays a role too.
For example, people who smoke are more likely to develop Crohn's disease.
If you suspect you have IBD, see your doctor.
Left untreated, IBD can lead to serious problems, such as malnutrition, bleeding, certain cancers, and overall poor health.
Your doctor should refer you to a gastroenterologist, specialist in digestive diseases, and will do tests to confirm a diagnosis. The goal of treating IBD is to eliminate inflammation so the disease goes into remission, symptoms stop.
This is typically done with medication and changes to your diet.
Most people with IBD will have recurrence of symptoms, flares. If these are severe, surgery may be required to remove parts of the bowel.
6. Celiac disease.
Symptoms: oily, foul-smelling stool,
Chronic diarrhea,
fatigue, stomach bloating,
nausea, weight loss.
Celiac disease is an autoimmune disease that causes inflammation in your digestive tract.
In people with celiac disease, eating gluten, a protein found in wheat, rye, and barley, triggers the immune system to respond. The inflammation damages the lining of the small intestine. See your doctor if you think you have celiac disease.
It is treated mostly by avoiding products that contain gluten.
Your doctor will also recommend regular blood tests to check for nutrient deficiencies.
This is because the inflammation caused by celiac can make it difficult for your body to absorb the nutrients in food.